In the late 1990s, the tobacco industry faced a groundbreaking legal battle that would change its landscape forever. The Tobacco Master Settlement Agreement, MSA, signed in 1998, marked a turning point in the fight against tobacco companies. Prompted by a wave of lawsuits filed by states seeking compensation for tobacco-related healthcare costs, the MSA aimed to hold cigarette manufacturers accountable for their actions and address the public health crisis caused by smoking. This agreement had far-reaching consequences, both in terms of financial implications for the tobacco industry and public health policies. Prior to the MSA, tobacco companies faced a barrage of lawsuits from individual states seeking compensation for healthcare costs incurred due to smoking-related illnesses. These lawsuits accused the industry of deceptive marketing practices, downplaying the risks associated with smoking and targeting vulnerable populations such as minors and low-income communities. The MSA was a response to this mounting legal pressure and aimed to resolve these disputes and establish a framework for future regulations. Under the terms of the MSA, 4 major tobacco companies, Philip Morris, R.J. Reynolds, Brown & Williamson, and Lorillard, agreed to make annual payments to 46 states, reimbursing for healthcare costs incurred due to smoking-related illnesses. These payments were set to continue indefinitely and totaled an estimated $206 billion over the first 25 years of the agreement. The funds were earmarked for various purposes, including public health initiatives, tobacco prevention and cessation programs, and education campaigns. One of the key provisions of the MSA was the imposition of advertising restrictions on tobacco companies. The agreement banned the use of cartoon characters, such as Joe Camel, in advertisements, as they were seen as a way to attract young smokers. Additionally, the MSA limited outdoor advertising near schools and playgrounds, placed restrictions on product placements in movies, and prohibited the use of brand name merchandise for promotion. These measures aimed to reduce the influence of tobacco marketing on vulnerable populations, especially children and adolescents. The MSA also led to significant changes in the way tobacco products were regulated and sold. It established the National Association of Attorneys General, which played a crucial role in overseeing the implementation and enforcement of the agreement. The MSA mandated stricter age verification for tobacco sales, increased penalties for retailers who sold tobacco to minors, and required improved product labeling and disclosure of tobacco industry documents. These provisions aimed to reduce youth smoking rates, enhance consumer awareness of the risks associated with smoking, and promote responsible marketing practices. While the MSA had a profound impact on the tobacco industry and public health policies, its effectiveness and long-term consequences remain subjects of debate. Critics argue that the agreement did not go far enough in holding tobacco companies fully accountable for their actions, and that the payments made by tobacco companies were significantly lower than the actual healthcare costs incurred by states. Additionally, some believe that the MSA did not address the global impact of smoking as tobacco companies continued to expand their markets internationally. Nonetheless, the Tobacco Master Settlement Agreement remains a landmark event in legal history and a catalyst for change in the tobacco industry. It brought attention to the devastating health effects of smoking, initiated stricter regulations on tobacco marketing, and provided much-needed funding for public health initiatives. The MSA served as a precedent for future legal action against tobacco companies and inspired other countries to pursue similar agreements to hold the tobacco industry accountable.